I am Dr. Mohammad Samir Zama, consultant cardiologist, Vijayanagar Colony, Hyderabad. For further details, you can call me on 9850 on any Sundays between 2 to 4 p.m. So this is a case of congestive heart failure. This is left ventricle, this is right ventricle, left atrium, right atrium. So all the chambers are dilated and the ejection fraction is very compromised. See, this walls of two sides of walls of the ventricle should come together, come nearer to each other, but it is just moving. Just here, this is this interventricular septum is moving, and here basal lateral wall is moving. All the walls are not moving well, and because of the dilatation of the LV, so there will be mitral regurgitation. See, the blood should go up into the from LA to LV, but it is coming back. It is called as mitral regurgitation. The reason for mitral regurgitation, because the LV is dilated, so the mitral leaflets, they go apart, they cannot close properly. So this is dilated LV, and the AML and PML are not coming together and closing properly. So there, because of that, there is regurgitation, mitral regurgitation. So because all the chambers are dilated, it is called as congestive heart failure. And the inferior vena cava also will be not moving properly, not closing properly. I have put the probe in left subcostal area. This is inferior vena cava. It is not moving, it is not collapsing with respiration. So it is because of the congestion of inferior vena cava. It also is a sign of severe left ventricular failure. So nowadays the treatment has improved. The medicines like valsartan, sacubitril, and dapagliflozin, beta blockers like bisoprolol. So these, and diuretics like Lasix and furosemide and ditar, those medicines which are decongestants, and and even angiotensin and aldactone like drugs also helpful in controlling congestive heart failure. So one should not, the junior doctor should not confuse this breathlessness with bronchial asthma. It is due to congestive heart failure, and patient should be referred to cardiologist, and proper treatment will improve the patient's condition. Thank you.